Hello, my dear friends. I'm Dr. Iman Bastawisi. I know that the exam for MRCOG Part 3 is very near, so I thought that maybe I can provide some help by preparing few short videos about topics that used to confuse me and my colleagues while we were preparing for our exam. So I hope these videos are going to be helpful for you. If it's so please let me know and communicate with me about any topics that you need me to prepare for you. So one of the important topics that used to confuse us is the legal aspects in the subfertility module. So I thought that starting with this will clear some points and make it easy for you. So let's not waste your time. Starting from the subject of the MRKH syndrome. This topic can appear actually in the general gynecology clinic or in the subfertility clinic. So I do encourage you to be very clear about your orientation. You need to know where are you, and you need to ask the patient clearly about her main concern. So this patient can appear as a patient with dyspareunia or secondary amenorrhea. Oh, sorry, it's going to be a primary amenorrhea, right? So if so, this patient is going to be from the very beginning about the her conditions. She doesn't know about it. You're going to counsel her about the finding in the scan and the karyotyping. You need to be extra empathetic and extra sensitive. However, in the subfertility clinic, usually the patient appears as a diagnosed patient, where she already knows about the nature of her condition, but she wants to know about her options to have a baby. So this is our case today, and maybe later, if you would ask me, we can do the other stations. All right, so let's begin. A case of simulated patient task with lay examiner, so it carries the highest mark, where you are ST5 in the subfertility clinic about to meet Mrs. Sarah, the 24 years old, and she's coming to discuss option for having a baby. Now, just to make it easy for you, I wrote it in color. So if you're practicing with your study partner and you missed any point, so you will be able to give marks to yourself. So if you miss a point that is written in green, that mean that you missed one applied clinical knowledge point for patient safety, is going to be in brown. And be very careful for points regarding patient safety, because in the exam, 2 points of patient safety to be missed, and unfortunately, the patient safety domain is going to be unfortunately failed. All right, so let's start. As usual, introducing yourself, confirm the patient name and age and NHS number, clarify clearly what is her main concern, and setting agenda by asking permission to ask some few questions to know more about her condition. Promise her to address all her concern, and very important advice is to tell her that you're going to give her patient information leaflet and to arrange for any essential referral and even referral to a support group if required and a counselor. You do this in the very beginning of your station, so in case you run out of time, so at least giving the patient information leaflet is an important point for communication with the patient and for patient safety. So it's an easy point. Make sure that you will not miss it. Now asking her about how long she's been trying to have a baby and if she's in stable relationship, just to build a rep with her. Now, a very common question that we used to start for all patients in the subfertility clinic is just tell me more about your periods. It's an open question that usually encourages the patient to tell you all the information, even if you are not asking about in detail, so it will save time. However, in this particular case, the patient will start crying and she will give you the reports of her ultrasound and karyotyping that shows the diagnosis of the syndrome. Here, you need to pause because she's crying, and you need to change the tone of your voice. Okay, Sarah, I understand this is a difficult moment for you. You're not alone in this journey. would you like us to wait for your partner to join us in this discussion, or would you like me to call a nurse to be with you? Here's a glass of water, Sarah. Okay, so you need to change the tone and the flow. Now, have you been connected to the support group and the counselor, Sarah? Okay, if she says no, then you need to tell her, I can arrange this for you. All right, so do you think you are able to resume the consultation? The care here, we are speaking, do you think we are able? So we are able, so this will give the patient impression that we are a team, you and the patient, right? Now, I'm sorry, Sarah, for some question that may appear intrusive, but again, it's important, so I will be in a better position to help you. May I proceed? All right. May I ask if you have been referred to a psychosexual specialist? All right. So have you been provided with vaginal dilator? Okay. This will show the examiner that you know that this patient has to be referred to the psychosexual specialist, and to solve her problem, usually we use the vaginal trainer or vaginal dilator. All right. And even she has no cervix, still she needs to practice safe sex. So please ask her about practice safe sex by using condom, right? Now the usual question that we ask about the medical history, surgical history, and the family history in general. However, in particular, you need to ask about any clot formation in legs or lungs, as this patient, if at all she requested for uterine transplantation, she will go for surgery. So you need to put this in her score for this surgery. And also you can ask about any family history of the same condition, as the MRKH syndrome, usually it's a sporadic condition. However, recently it was found that it has some tendency to run in families. All right. So allergy, again, is a very important and constant patient safety question. Weight to height ratio, blood group, underage type, any concern regarding blood transfusion, and this patient may go for surgery. Smoking, drink alcohol, or consuming any recreational drug, and do you feel supported and safe at home? Now, the subfertility clinic, you need to clarify about the partner, very important, if he's fit and well, if he fathered any children before, did he has his semen analysis done or not, what was the result? If you would allow me, I can, after your permission and his permission, I can check for the results. If he is following with the GP for any condition, did he have any surgery in his private area? Does he smoke or drink alcohol? Is he overweight? Is he facing any problem during the intimate relationship? Right? Now, by this, you thank her for sharing this information with you, because this is a privilege that she's sharing very sensitive information with you. And now coming to your concern, coming to your options, Sarah. We have 3 options for you, Sarah. You need to enumerate them first, okay? Adoption, surrogacy, and uterine transplantation. Well, adoption is a chance to embrace parenthood while giving a loving home to a child in need. I'm sure there are a lot of children who need a kind mom like you. You need to be gentle with this patient, all right? Give her some positive impulse. So I can give you some leaflets which will help you to know more about this option, to meet other who chose this option to tell you about their experience. Second option is surrogacy. It is when a woman, we called her the surrogate, carries and gives birth to a child for another person or couple. And last option is the uterine or womb transplantation. It's a surgery, Sarah. Well, do you have any preference to start with? This is an important question, my dear friend, because typically the patient is going to choose one option to dig more. So let's take it one by one. Well, these tables and flowchart I added for you, my dear friends, because sometimes the stations can come as simulated patient task or can come as structured discussion. So if at all it comes in structured discussion, so these information may be asked for by the examiner. All right? So for Sarah, if she's willing to have a baby that is biologically related to her, then you will need to run some tests. First is the hormonal test. You'll tell her that we will need to test for some hormones for you to check if your egg basket is releasing eggs. Also, we will test for some infection like rubella, hepatitis, HIV, and syphilis. Your partner's semen analysis, if it was not done, is going to be requested. And I may also refer you to what we call the genetic counselor. So to ensure that your baby will not have any same condition in case she has this condition running in her family. And Sarah, with your permission, I need to double check with your GP that a scan has been done for your kidneys. By this question or by this statement that you cover two important modules, patient safety module and communication with colleague. As you double check with her GP means that you do not underestimate your colleague, all right? However, you still keep her safety in your priority. Now, you and your partner, we call you the commissioning couple. We have two types of surrogacy, full surrogacy and partial surrogacy. For the full surrogacy, where the baby will be formed by test tube baby from your egg and your partner's sperm, and then transferred to the surrogate mother. Here, the surrogate mother is genetically unrelated to the child. For the partial surrogacy, when direct insemination of your partner's semen to the surrogate mother, and here the surrogate mother will be genetically related to the child. Am I clear so far? You need to check understanding. You give the information in chunks and check and understanding frequently. Now, it's clear that it is legal in UK. However, it should be a non-profit process, and there are non-profit organizations can help you if at all you cannot find a surrogate mother. The surrogate is usually the legal mother for the baby, and if she has no partner and the treatment is undertaken in a licensed clinic, the child will be legally fatherless. If she has no partner and the treatment did not take place in a licensed clinic, then the commissioning father will be the legal father. Are you with me, Sarah? All right. Now, you can be the legal partner, parents. Usually the patient at this stage will ask you, okay, so I will not be able to be the parent of the baby. No, you can be the legal parent of the baby, either by adoption or by applying for a parental order. Parental order has the same effect of adoption, my dear friend. It only has a quicker route. So applying for parental order should be between the 6 weeks and the 6 months after birth, and only after consent of the surrogate mother. You need to be very clear that the NHS does not routinely fund for IVF for surrogacy arrangement, even if the patient has some congenital abnormality. However, she can apply for individual funding request process or at least partial funding for fertility and IVF treatment, and this can be arranged by her GP. Now, the other option is transplantation of a womb, Sarah. May I proceed? Yes, doctor. Okay. Now, typically, a womb can be obtained either from a living or a decreased donor. And by surgery, we can transfer this womb into your tummy. It will give you advantage of having the experience of being pregnant, being biological, social, and legal parent to the baby. However, it is a major surgery that carries some risk of bleeding, infection, damage of any organ in your tummy. Also, sometimes your body defense mechanism can attack the womb. We call this rejection. This may result in a decision of removing the womb. Here, you need to pause and again change your tone. I'm so sorry, Sarah. I don't intend to scare you here, but I have to be honest and transparent with you. May I proceed? All right. For this, Sarah, we will provide you with some medication to protect the transplanted womb from the attack of your body defense mechanism. We call them immunosuppressant. They carry some risk that it can harm your liver or your kidney. After 6 to 12 months following the surgery, and while you're using baby-friendly immunosuppressant, we can transfer the tiny baby, we call it the embryo, that is formed by the test tube baby from your egg and your partner's sperm. And we can transfer it inside the cavity of the womb. During pregnancy, we usually consider this as a high-risk pregnancy. So you will be followed by a highly specialized team. We call them the fetal-maternal medicine team, also specialized midwife. The transplantation team are going to be involved, blood doctor, baby doctor, and a counselor. Are you following me, Sarah? All right. You will continue with the immunosuppressant all through your pregnancy. This situation can put you at some risk, Sarah. That's to say, sometimes you have high blood pressure with protein in urine. Sometimes the blood sugar can be raised. Repeated infection can occur. And again, rejection may occur. For your baby, the baby can be smaller than expected, or sometimes we are enforced to deliver the baby earlier than it should, the proper time. Again, Sarah, I'm so sorry to tell you such information, but it's important that you have full picture to decide as you wish. Now, the delivery usually by cesarean section, Sarah, at 37 weeks of your pregnancy. After, we inject you with a steroid to enhance the function of your baby's lung. If you don't have planned for further pregnancies, then after delivering your baby in the cesarean section, we remove the womb. We call this cesarean section hysterectomy. And then you will be able to stop the medicines, the immunosuppressants, with all the hazard that it can put you in. If you still have planned to have other babies, then we will keep the womb and you will continue on your medication till you complete your family, and then again, a surgery is going to be done to remove this womb. Do you have any questions, Sarah? Typically, the patient is going to be confused, and this is normal. So you need to tell her that it's normal. This is normal, Sarah. Let me give you some patient information leaflets regarding the subjects that we have discussed. You can take your time and maybe discuss with your partner, and I will arrange another meeting with my consultant as he can answer your further questions and clear any doubts. Okay, I'm going to set also appointment with a counselor and connect you with the support group. And as per our agreement, I will communicate with your GP. Would that be okay for you? Yeah, that was very nice to meet you, Sarah. All right, and here you end your station. I hope this video was helpful for you. If you find this video valuable, please subscribe and let me know about any topic that you want me to prepare for you. Thank you so much for your time.